Because throat swelling is a medical emergency that requires prompt medical attention, every patient should have a contingency plan in place to deal with life-threatening HAE attacks. The situation is complicated by the fact that HAE is a rare disease, and not every emergency room will have HAE medicines in stock. Therefore, the HAE Association's Medical Advisory Board recommends that every patient work with their local emergency room to ensure that the attending physicians are aware of HAE and that treatment is available.
What are some of the challenges in putting an emergency plan in place?
An emergency department is very good at treating life-threatening problems in general, but sometimes there's a lack of education about or awareness of HAE. Therefore, patients will likely need to take proactive steps to educate ER doctors about HAE and the available treatments. Many patients have found it helpful to have their HAE doctor prepare a letter that briefly explains HAE and then set up an appointment with the ER director to discuss the information included in the letter. During this meeting, you should ask the ER staff to set up a file for you that includes information about you, HAE, and the treatment that you will be receiving. Some ERs will set up a flag on the patient file or a folder with treatment specifics.
Many HAEA members carry wallet ID cards with their physician's contact information. A sample physician's letter printable from this page may be helpful, and an HAEA patient services representative may also be able to get an HAE physician expert on the phone to speak peer-to-peer with the ER doctor.
Even if an HAE patient has relatively mild HAE, that is, they only swell maybe a couple of times a year, and some patients do only swell that infrequently, is it still important to have HAE medicine readily available in case of an emergency?
It's absolutely necessary. Past history of HAE attacks is no predictor of future HAE attacks. For instance, a patient who's never had an airway swelling in their life may have one suddenly in their later years. So it's crucial for each and every HAE patient, no matter how few attacks or how mild their attacks may have been so far in their life, to have a plan and access to HAE medication.
So a plan for any unforeseen HAE emergency could take one of many forms?
Right. It may be as simple as self-administering an approved product at home, though most experts recommend that patients with airway swelling go to the hospital for observation, even with self-administration of medication. Or a patient may choose to arrange to have their medicine stored in the ER and available to be administered by an ER doctor. Another option is to bring HAE medication from home to the hospital and have the ER staff administer it. This is often called brown bagging. In all of these instances, there's certainty that medicine is available. If a plan for an HAE emergency includes going to a doctor's office, patients should be aware that these sites can only help during business hours. In some cases, patients have had home health care nurses come out and administer an FDA-approved treatment. So there's no right or wrong way to construct an emergency plan, but it's extremely important that HAE patients sit down and talk to their doctor about their plan. The discussion should be, what's going to work best for me, the patient? To make sure all the bases are covered, it's important for every patient who plans to self-administer their HAE medicine to have another trained person who's available to administer their medicine if needed.
What's a good plan for HAE patients who are traveling?
The best option is to bring along medicine that you can self-administer. If that option's not available, then patients who are traveling should contact their HAE Association patient services representative, who will provide contact information for an emergency room that has HAE medicines in stock.